Welcome to the Deep Dive. Today we're diving into something that I think you'll find pretty fascinating and maybe even useful in your practice.
Oh yeah, definitely.
It's the potential of creatine to actually boost brain power. Specifically, we were thinking about this for our patients. We've got 3 research papers to unpack.
Really interesting stuff.
Yeah, and it looks like some pretty interesting things are happening in the world of cognitive health.
Absolutely. It's a hot topic these days, and for good reason. You know, with concerns about age-related cognitive decline on the rise.
Right.
This research on creatine couldn't be more timely.
Yeah, 2 of the papers that you sent over, effects of creatine supplementation on memory in healthy individuals, a systematic review and meta-analysis of randomized controlled trials,
Okay.
and then also the effects of creatine supplementation on cognitive function in adults, a systematic review and meta-analysis.
Right.
These both take a really broad look at this question of creatine in the brain, and they analyze data from a bunch of individual studies, which is really helpful, I think, to give us kind of a solid picture.
Exactly. It's like getting the big picture view instead of just little snapshots.
Right.
And what's really exciting is that these meta-analyses,
Yeah.
they suggest that creatine could actually be a real player when it comes to improving memory.
Oh,
And we're not talking about just a handful of people here. They looked at a combined total of over 1,500 participants.
wow.
So the evidence is pretty robust. You can imagine the impact this could have on your patients who are worried about memory loss.
Yeah, I mean, okay, so it's not just for like
Right.
bodybuilders or people looking to bulk up.
Exactly. Creatine's benefits might extend far beyond the gym.
So how does this even work? Does it like magically transform our brains into supercomputers or something?
Not quite magic, but the science is pretty fascinating.
Okay.
Our brain cells are energy hogs,
Really?
constantly firing signals and needing fuel to keep going.
Ah.
And creatine seems to step in here to provide this extra energy boost.
Oh, interesting.
It's like giving those neurons an extra helping of fuel to keep them powered up.
So it's like giving our brains a little caffeine kick.
Yeah, you could think of it that way.
Okay.
But in a way that specifically targets memory function.
Wow, that's interesting.
Now, while the memory improvements are promising, it's important to note that the effect on overall cognitive function wasn't as clear-cut.
Oh, so it's not like a cure-all.
Right. It seems like creatine might be more of a specialist targeting memory specifically rather than a general cognitive enhancer.
Gotcha. But even focusing on memory is still huge.
Oh, absolutely.
Especially given how often we hear patients complaining about memory problems.
Exactly. Memory complaints are incredibly common in clinical practice.
Yeah, so this could be a real game changer. Now, the reviews also hinted that creatine might work better for certain people.
Right.
What did you find most intriguing there?
Well, the subgroup analyses were particularly interesting. For example, younger adults seem to respond better to creatine than older adults.
Why would that be?
It could be due to age-related differences in how our bodies process creatine. It's a fascinating area for further research.
Yeah, so age is one factor that seems to play a role. Now, what about that third study? The effects of creatine supplementation on cognitive performance. A randomized controlled study?
Yes.
Yeah.
That one took a slightly different approach.
Yeah.
This randomized controlled trial, or RCT as we call it,
Right.
focused on vegetarian versus omnivore participants.
Okay.
They gave them 5 grams of creatine daily for 6 weeks.
Okay.
And they wanted to see if dietary creatine intake, which is generally lower in vegetarians, would impact the supplement's effectiveness.
So they were basically testing if those who already get creatine from their diet,
Exactly. From meat,
in this case,
would see less of a benefit than
Presumably.
taking creatine supplements.
Exactly.
What did they find?
Well, the results were a bit more nuanced than the meta-analyses. They did find a small positive effect of creatine on memory, but it wasn't quite statistically significant.
Interestingly, though, vegetarians didn't experience a greater benefit than omnivores,
Oh, that's interesting.
which kind of challenges the assumption that their lower baseline creatine levels would lead to a more pronounced effect.
So dietary creatine may not be as big of a factor as we initially thought.
That's what the study suggests.
Now, before we get too carried away talking about all these potential benefits,
Yeah.
we need to address the elephant in the room,
Uh-huh.
which is side effects.
You're absolutely right. We can't ignore that aspect.
Yeah, this is where things get a little tricky.
Absolutely. Any intervention can have potential downsides, and creatine is no exception.
So what did this study find?
Well, the RCT found that creatine supplementation did lead to more reported side effects compared to the placebo group,
Oh, no.
which is something to be mindful of when considering its use in patients. It's not a risk-free intervention.
Right, that's definitely a red flag. What kind of side effects are we talking about? Anything serious?
Fortunately, the reported side effects were generally mild, mainly digestive issues like stomach upset and some reported weight gain.
I see.
But it does highlight the need for careful patient selection and monitoring.
Yeah, for sure. Especially for those who might have pre-existing conditions.
Absolutely. We need to be cautious and weigh the potential benefits against the risks for each individual patient.
All right, so we've got kind of a mixed bag here. It seems like there's some solid evidence for memory improvement.
Right.
Some hints that certain groups might benefit more than others. But then we also need to be really aware of these potential downsides.
Exactly. It's a complex picture, and that's why it's so important to dive deep into the research.
Well, I'm already starting to see how all of this could change how I talk to my patients.
Absolutely. These findings have real-world implications for clinical practice.
And that's just the tip of the iceberg. We haven't even touched on how creatine affects different types of memory,
Right.
or whether challenging tasks benefit more,
Mhm.
or what the optimal dosage is.
There's so much more to explore and unpack.
So much to unpack. This is where we take a quick pause. When we come back, we'll translate all this research into practical advice for you, what this means for your practice, and how you can use this knowledge to actually help your patients. So stay tuned.
Looking forward to it. Okay, so let's talk about what all this means for you, when you're actually seeing patients every day.
Right, like how do we actually apply all of this research to, real-life clinical practice?
Well, first things first, it's crucial to remember that the evidence on creatine and cognition, it's still evolving.
Right, it's not like a done deal.
Exactly.
Yeah.
We need more research to really nail down those long-term effects, the optimal doses, how creatine interacts with different health conditions, all that good stuff.
So we're not going to start prescribing creatine to every patient that walks through the door.
Haha, right. That's not the takeaway here.
But I can definitely see how this information could be super valuable
Mm.
when a patient comes in and is asking about, their brain health or worried about memory problems.
Absolutely. If a patient brings up creatine, you can now have a much more informed discussion. You can explain that while it's primarily known for its role in muscles,
Right.
there's growing evidence suggesting a potential memory boost.
And we can actually point to those meta-analyses
Exactly.
as a solid source of evidence.
That's right. It's not just anecdotal evidence or marketing hype.
Exactly.
We have some solid research to back it up.
Right. That's a game changer for these conversations.
Absolutely. And you can highlight that the strongest findings really relate to memory,
Mm-hmm.
especially for tasks that require a bit more brain power.
Oh, that's interesting.
Yeah.
So I'm thinking this could be really relevant for patients who are dealing with age-related cognitive decline, or maybe even those in the very early stages of dementia.
It's definitely worth considering.
Yeah.
But I cannot stress enough the importance of an individualized approach here.
Right, of course.
You need to carefully evaluate each patient, their health status, existing conditions, current medications,
Mm-hmm.
to determine if creatine is appropriate and safe for them.
Of course. And we can't forget about those potential side effects.
Right. Even if they're generally mild,
Right.
they could be more problematic for some individuals than others.
Yeah, so it's not risk-free.
Exactly.
Yeah.
Discussing those potential side effects.
Like what kind?
Well, like we talked about stomach issues,
Right.
weight gain, those are important things to mention.
Yeah, for sure.
And of course, you want to monitor patients for any unusual reactions or adverse effects.
So it sounds like creatine shouldn't be viewed as like a quick fix
No, definitely not.
or a one-size-fits-all solution.
Well, absolutely. It's not a magic bullet. It's a tool that, when used appropriately,
Mhm.
as part of a broader approach,
Right.
might contribute to better cognitive health.
So it's part of the bigger picture.
Exactly.
Along with things like lifestyle changes.
Right.
Exercise, mental stimulation, a healthy diet.
All those things play a role.
Right. So for those patients who we think might benefit from creatine,
Yeah.
what about dosage?
That's a great question, and unfortunately, there's no definitive answer yet.
Okay.
Most studies have used around 5 grams daily, but we need more research to determine the optimal dose, specifically for cognitive enhancement,
Right.
and how that might vary based on individual factors.
Okay, so back to that personalized approach,
Exactly.
carefully considering each patient's needs and circumstances.
Absolutely. And when discussing dosage, it's also vital to address potential interactions with other medications.
Oh, right. That's a good
For
point.
instance, creatine can impact kidney function.
Oh.
So caution is needed for patients with existing kidney issues or who are taking medications that could affect their kidneys.
That makes perfect sense.
Yeah, so thorough medication review is key before recommending creatine or any supplement for that matter.
Right. I think this really highlights the importance of teamwork,
Oh, absolutely.
working with pharmacists and other healthcare professionals to really manage patient care effectively.
It's a team effort, especially when we're dealing with complex issues like cognitive health and potential supplement interactions.
So just to recap what we've learned so far,
Mm.
it seems like creatine does show some potential as a cognitive enhancer,
Yeah.
particularly for memory.
Yeah.
But we need to be cautious. Consider those individual patient factors
Absolutely.
and really stay updated on the research as it evolves.
Couldn't have said it better myself. And one final point, I think patient education is paramount.
Yes.
Make sure your patients understand that creatine isn't a magic bullet.
Right.
It's a tool that, when used appropriately as part of a broader approach, might contribute to better cognitive health.
I love that. It's about empowering patients to make informed decisions.
Exactly.
And to actively participate in their own care.
That's the goal.
And I think this also emphasizes the need for us as healthcare providers to keep learning,
Oh, for sure.
to stay current on the research so we can really guide our patients effectively.
Absolutely. The scientific landscape is constantly changing, and we have a responsibility to evolve our practice along with it.
It's a thrilling time to be in healthcare, though,
It really is.
with so much potential for innovation and impact.
I completely agree. But I think it's also important to acknowledge that all this information can feel overwhelming at times.
Yeah, it's a lot to digest.
It is. That's why resources like this deep dive are so crucial.
Right.
They help to break down the research,
Yeah.
highlight those key takeaways, and make it more digestible for busy clinicians.
Absolutely. And we'll be sure to include links to the studies we discussed in the description below,
Perfect.
so you can explore them further at your own pace.
Right.
But before we wrap up, we want to hear from you.
We do. What are your takeaways from this deep dive?
Yeah, what resonated with you most during our discussion? Are there any specific patient populations you think might benefit from creatine supplementation? And what strategies can you envision implementing in your own practice to incorporate this research?
We're all ears.
Your insights are super valuable to this conversation.
Absolutely. So please share your thoughts, your questions, your experiences in the comments below.
We're excited to learn from you. You know, one thing that really stood out to me was that whole idea of personalized medicine, when it comes to creatine and brain health.
Oh, absolutely. That's a crucial point.
We talked about how age, gender, even other health factors seem to play a role in how well creatine works for different people.
It's not a one-size-fits-all kind of supplement.
Right. Like imagine a future where we could actually use like genetic testing or biomarkers to really pinpoint exactly who would benefit the most from creatine.
That would be amazing.
Right? We could tailor the dosages, create personalized treatment plans, maybe even predict who might experience side effects.
That's a fascinating concept. We're already seeing personalized medicine take off in other areas of healthcare.
Right.
Why not apply it to brain health as well?
Exactly. It could really revolutionize how we approach cognitive decline.
Absolutely.
And help people really optimize their brain power.
I love that. And this deep dive, it really highlighted how much we still don't know about the brain.
Right.
And how supplements like creatine impact it.
There's so much more research to be done.
It's exciting. It's a constantly evolving field.
Absolutely.
And as healthcare providers, we have a responsibility to stay informed.
Right.
Critically evaluate the evidence and find those practical ways to use that knowledge to improve patient care.
Well said. And that's what the deep dive is all about.
Exactly.
It's equipping you with the knowledge and insights you need to really navigate these complexities of healthcare and provide the best possible care for your patients.
Absolutely. We hope this deep dive into creatine and cognition was helpful, sparked some new ideas for you.
And remember, if you want more details about the research we discussed.
Yes, definitely check out those studies.
Effects of creatine supplementation on memory in healthy individuals. A systematic review and meta-analysis of randomized controlled trials. The effects of creatine supplementation on cognitive function in adults. A systematic review and meta-analysis.
Right.
And the effects of creatine supplementation on cognitive performance. A randomized controlled study.
You'll find links to all of those studies and more information in the description below.
So now we want to hear from you. What are your biggest takeaways from this deep dive?
Yeah. How might this information influence your approach to patient care?
We're all ears. Share your thoughts, your questions, your experiences in the comments below.
We love hearing from you.
Thanks for joining us on the deep dive. Keep learning, keep asking questions,
and keep striving to make a difference in the lives of your patients.